Health planning and management. The goal, ultimate desired state towards which objectives and resources are directed, and it is not constrained by the time or resources. What is objective? It is pre-planned and endpoint of all activities in a health program. And the target. What is the target? The degree of achievement of objectives with a time limit. There are some committees. First, the Boer Committee in 1946. It is also known as Health Survey and Development Committee recommendations. They asked like one PHC per 40,000 population and 75 beds they asked, and the 3 million plan aim also they asked, like in the secondary health units, the tertiary health units. In the secondary health units, like 650 bedded hospitals, and also tertiary health units like 2500 bed hospitals they asked. And he told social physician like 3 months training in PSM, and he told school health services was initiated. And the modular committee recommendations they asked like 1 PHC per 40,000, same like Board committee. And we should have formulation, they asked like we should have formulation of all India health services. So they told in district hospitals with specialist services doctors. And the Chada committee, they worked for eradication of malaria, basic health worker like per 10,000 population. His duty is to ask in a village like if anyone have malaria or not, like it's a survey, a family planning activities, registration of birth and deaths. And Mukherjee committee in 1956 to 66, they asked that dealing malaria activities and family planning activities. And Jangalwala Committee in 1967, Committee on Integration of Health Services. They told that equal pay and equal work. Special pay is specialized work. They told that ban on private practice of central government doctors. Okay. And the sixth one is the Kartar Singh Committee in 1973. They bought concept of multi-purpose health worker, either male or female. If the male means the malaria surveillance, female means they need to ask family planning activities such as like that. 1 PHC, then they also told that 1 PHC for 50,000 population. The concept of health supervisors or health assistants. And also the seventh one, Srivastava Committee in 1975, they brought the concept of bands of semi and para professional health workers, village health guide concept, and also the Rome scheme. Rome scheme means reorientation of medical education, referral services, primary, then goes turn into secondary and turn into tertiary district hospitals. And eighth one is high level expert group committee, which recently came 2011. Universal health coverage includes 3.5 year MBBS course. They told BSc community health, community ASR officers. 1 Aisha is per 500 population, but they didn't implement anything till now. Niti Aayog, National Institution for Transforming India, replaced Planning Commission in 2015. What is the management techniques? Cost benefits analysis. Input and output are measured in terms of money. How much money you are putting and how much money you are getting, that is cost benefit analysis. Cost effective analysis. Output is measured in terms results. Example, lives saved, death prevented, children and adults vaccinated. Management technique which is more appropriate in health center. Input output analysis. How many units input are needed to achieve 1 unit of output? Suppose if you have a FMG exam on, then you need to clear 19 subjects first, then you need to be perfect in 19 subjects, like that. And also the system analysis, the comparison of 2 or more cost effective alternatives in a health program. Example, if there is a TB program, then we need to say that sputum smear, chest x-ray increases, and CBNAT. And a network analysis, graphical representation of all activities to reach the goal. PERT, program evaluation and the review technique, sequence of activities in a health program to plan, monitor, schedule and finish timely reports. What is the CPM? Critical path method. It is a longest path to complete a critical path. Example, if I want to start a hospital, then I need to give services like OBC, pedia, anesthesia, something like that. Work sampling, systemic observation of recording activities of 1 or more individuals at a predetermined or random intervals. and also the national health policy, which is in 2017. The goals highest possible level of health and well-being for all at all ages. There are mainly 7 targets. We'll discuss only 4 targets. Target 1 is the coverage of health services by 2025. Antenatal care sustain more than 90%, skilled birth attendance more than 90%. And target 2, which is life expectancy, increase life expectancy at birth from 67.5 to the 70 years by 2025. Reduce total infertility rate to 2.1 by 2025 year. Target 3 is mortality by age, reduce under 5 mortality by 23 by 2025. Reduced maternal mortality rate MMR 100 by 2020. Reduce infant mortality rate IMR 28 by 2019. Reduce neonatal mortality rate NMR 16 by 2025. Target 4 is reduction of diseases, eliminate leprosy and Kala-Azar, filariasis, TB, but none of the achieved. And sustainable development goals 2016 to 2030. They proposed and formulated by United Nations, replaced Millennium Developmental Goals. Now it is replaced by Millennium Developmental Goals 2000 to 2015. There you can see there are many goals, like goals 17 goals, but we'll discuss mainly on goal 3. What is goal 3? The directly related to health, living and well-being at all ages. Technical advice, resource and grants provided for standard sustainable development goals by United Nations Development Program. Goal 3 sub-goals, there are 3.1 reduce MMR to maternal mortality rate to less than 70 out of 1 lakh live births, and 3.2 reduce NMR to 12 out of 1000 live births, and under 5 MR mortality to 25 out of 1000 live births. 3.3 end epidemics of AIDS, TB, malaria and other topical diseases. 3.4 reduce premature deaths due to non-communicable diseases by 1/3, like serious diseases. 3.6 it is reduce deaths due to the road traffic accidents by half. 3.8 achieve universal health coverage.